want to make sure that those who need a test can get a test very safely, quickly, and conveniently. But we don't want people to take a test if we feel that they shouldn't be doing it. And we don't want everyone running out and taking, only if you have certain symptoms.
President Trump discussing the major failing that everyone has heard about in the U.S. Trump administration coronavirus response thus far, the testing. The U.S. has been lagging far behind many other nations, including South Korea. Donald Trump very clearly not taking responsibility and going further to say it's not his fault.
Dr. Fauci said earlier this week that the lag in testing was, in fact, a failing. Do you take responsibility for that? And when can you guarantee that every single American who needs a test will be able to have a test? What's the date of that?
Yeah, no, I don't take responsibility at all, because we were given a set of circumstances, and we were given rules, regulations, and specifications from a different time.
Now, a few states have opened drive-through testing centers. Demand, though, far outstrips supply. The New York Times has reported. Meanwhile, many people across the country who are sick or symptomatic are being denied the test, quote, even though they have been in proximity to someone who tested positive, and even though they had fevers and hacking coughs and lived in cities with growing outbreaks. We're joined now by Pulitzer Prize-winning journalist and New York Times reporter Farah Stockman, who wrote that very article. You are busy. Thanks for making some time. What should viewers know about what you were finding in your reporting?
Well, the biggest takeaway was that we're only testing a very small number of people. So you have to be very sick to get a test in most places. And so if you consider that 80% of people who have the new coronavirus have only mild symptoms, there's a lot of people walking around out there who have it and don't know they have it, may never know they have it, and they're spreading it, which is why we're seeing school closings and all of that.
Let me play something again. We've been mixing our data and our public health reporting with the qualitative reporting. This is a woman in Seattle. We had the mayor from there yesterday, obviously one of the most hard-hit areas, discussing basically contracting it from a small gathering. Take a listen.
Several of his friends went to the doctor and they were refused coronavirus tests because they also didn't have a cough. So we enrolled in a research study, the Seattle flu study. In the last couple of weeks, due to the public health emergency, especially emerging here in the Seattle area, they started testing for COVID-19. So I submitted a nasal swab sample. And then this past Saturday, I got a call from the research coordinator saying my sample had tested positive.
How does one story like that relate to what you've been finding in your reporting?
Well, when I started reporting this maybe 2 weeks ago, most of the people that I talked to, I thought, oh, these people are probably the worried well. These people are probably okay. They have a cold and they're hypochondriacs, or they're a little bit nervous about this virus. But man, in the last 2 weeks, we have seen community transmission. We have seen cases like this where they weren't actually so sick that they should be hospitalized. Some of them would not meet the criteria for a test here in Boston, and yet they were positive, and they only found out they were positive because of the Seattle flu study. It's a scandal. It's crazy. We actually, the truth is, we just don't know how many people have this because we're not testing enough. And the more people I talk to, the more I realize that this is out there, and people are, even in the best of times, it's very hard to navigate the U.S. healthcare system. But right now, it's just almost impossible for somebody who hasn't been to Wuhan, China, and isn't, just on death's doorstep to get a test in a lot of cities.
As you say, people are navigating a complete healthcare maze, often with dead ends, even when they get through parts of it. I appreciate your context on the numbers. We have been trying to be very clear with people on what we know and don't know. And this is a scary time, but does not need to be a panic time. On the screen, we have the case count, which, as you emphasized for the reasons you stated, is a floor, not a ceiling. With that in mind, a final question you would be, how should people understand that case count? It's gone up over 30% since yesterday to what people see here, over 2,100 U.S. reported.
We are just catching up to this. And so that is a tiny percentage of the people in the United States who have the virus. It just is. Because most of the people who have it will not have symptoms that will meet the criteria for getting tested. And so that's why things like social distancing, washing your hands, is really important. And if you look at a country like South Korea, they've tested, I think, 240,000 people. 1 out of every 250 people in South Korea have been tested. It's free. It's easy. They go through a drive-through and they get a text message in the morning. We are so far away from that. But epidemiologists will say we need to be testing a lot of people so that we know how prevalent this is in the community, and we know whether things that we're doing are working. So when we close a school, is it working? We have no data, so we don't even know that. We're kind of flying blind here.
Well, your report helps us fly a slightly little bit less blind. So shout out to investigative reporting and storytelling as we go forward. Farah Stockman, thank you so much. Hey, I'm Ari Melber from MSNBC. You can see more of our videos right here, or better yet, subscribe to our YouTube channel below. You could have been anywhere in the world, but you're here with us, and we appreciate that.